Now recognize Dr. Barra from California for 5 minutes of questions.
Thank you, Dr. Walensky, for your service and certainly your work as CDC director. Mr. Chairman, I have the privilege of sitting on the CSI Commission for Strengthening America's Health Security, and one of the task forces that a subgroup put together a report, Building the CDC the Country Needs, comprehensive. It included former CDC members, nonpartisan health experts. I'd love to, Mr. Chairman, I'd love to enter that to the record.
Without objection.
Great, thank you. Dr. Walensky, one of the recommendations out of that report was looking at a reorganization plan, and I know you undertook the reorganization plan. I'd love to get a sense of major findings and the status of that reorganization.
So among the things that we learned is that there were layers of bureaucracy that were happening that within the agency, that things that were really essential, our public health infrastructure related things, our Office of Readiness and Response, our laboratory systems, our data systems were buried in layers of bureaucracy and not within like the immediate Office of the Director line of sight. So among the things that was so critically important in this reorganization that was completed, I believe, in the end of February, and we're actively acting under that new reorganized structure, was to have those layers, those really important public health infrastructure components, science, data, laboratory, readiness, report immediately into the Office of the Director, full line of sight, and to get rid of those bureaucracies.
Great. One of the other recommendations, and you touched on this, was on the communications front and how we translate the science into guidance in a way that, I watched my wife, who's also a physician and runs a large system of community health centers, going to the CDC website on a daily basis during the pandemic, using that information to provide guidance to her healthcare professionals, but also how do you translate that science, knowing that lay members of the public were now going to the CDC website? You touched on it a little bit, but could you expand on some of the efforts there?
Yeah, I think you hit the nail right on the head. As a consumer, before coming to the CDC, you put C in my Google bar and it came up with CDC, right? We were on the guidance all the time, and most people hadn't heard of the CDC. So it was the people, the healthcare workers, public health workers, who were in the trenches who needed to know and understand. The language was for them. All of a sudden, CDC was splashed across the pages. People were, it was in the news. People were going to CDC guidance themselves. It was never really intended for the average American consumer to consume our web pages. And we now need to recognize that that is who our audience is, and we need to be able to have an audience for our public health workers, our healthcare workers, our healthcare providers. But we also, we also need to have web pages that are consumer ready for the American people so that they can say it in lay language that they understand.
Right. And you touched on this, the workforce issues and building a public health system that we deserve. The pandemic really did expose an under-resourced, fragmented public health system, where data wasn't shared readily or quickly, where we weren't doing disease surveillance, wastewater surveillance, and a lot of deficiencies in our public health system. It'd be a shame for us in Congress not to take the resources and put those resources into a public health system that we all deserve. One of the areas that I really worry about is some of the rhetoric coming out of the pandemic really does erode trust in what should be the most trusted public health organization in the world, the CDC, which historically has been, but it's multiple other areas, and that we're discouraging that young generation of folks who really did grow up in the midst of the pandemic. This should be a time where they're stepping up to come work for us. Maybe in the short period of time that I have, if you could just reiterate the things that we should be thinking about in Congress to help build that workforce.
Maybe I will just emphasize, thank you for that opportunity. This nation is an estimated 80,000 public health workers in deficit to perform and that is a report outside of CDC, to perform the standardized public health duties of this country. We need public health workers. In order to do that, certainly tax exempt loan repayment, so people are encouraged to go in. People leave medical school with $200,000 in debt. So they're encouraged to go into this field. It's an incredible field, and yet during this pandemic, we have some health departments that report 50% of people leaving. We need those public health workers if we are going to be primed and ready for any threat that comes next.
Great, thank you. I've used my time, so I will yield back. Thank you again for your work.
Thank you.
I now recognize Dr. McCormick from Georgia for 5 minutes of questions.
Thank you, Mr. Chair. Director Walensky, it's good to have you here today. Thank you for being with us. It was funny, I was just talking to Dr. Howery today, who is my old attending at Grady and Emory when I was a resident. I will say also thank you for your service during the pandemic. I too was on the front lines of this pandemic from the very beginning, all the way through December of this last year. So watched the entire evolution of this disease process with dismay at times that we politicized it so much. As a matter of fact, I would make the case that probably the biggest mistake, and this, I'm going to ask your opinion on this in a second, the biggest mistake maybe we made of all the different things, the different guidances and everything like that, that's all fine. I think we did our best. But the problem, the biggest problem is, and a lot of people point this out all the time, is we let this become political rather than medical, rather than a healthcare question, whether instead of letting doctors talk to their patients about this, we had politicians talking to prompters. You had people who had access to you to try to give you input, did, whatever, it doesn't really matter, rather than doctors. I remember Jerry Williams, a doctor out who's an urgent care physician who treated thousands and thousands of patients with great success, wanted to have access but couldn't get access, but a teachers union gets to have your personal cell phone number. I think that's egregious because it became political. I think you're a scientist. I think you're a person who understands an infectious disease process. Do you think that the biggest problem, I think the biggest problem, and I'm going to ask you if you think this is the bigger problem, the biggest problem with all the misinformation, with all the fact that we had black liberals and white conservatives both mistrusting this disease and not doing the right thing, a lot of times not following the science, because both sides were politicized so bad that nobody could figure out what the truth was anymore. Because it was politicized, we couldn't get to the truth. Would you agree that was one of the biggest problems we had with this disease?
Yeah, I would say that, first I want to say that many scientists and state health officers, I have given every one of our state health officers my direct cell phone at some point in time over the last 2.5 years so that they had access to me too, so that they could see what was happening on the ground. So that was not that was a frequent event that people would have access to me. I do think that when politics have become involved in what we are trying to frame, what should be framed as a medical health measure, we get mis and disinformation, we get vitriol splashed across the pages of public health workers doing the hard work of public health. We get threats to our public health workers that limit what they are able to do and have them have fear in terms of doing their job and doing it properly. Poor press, I think all of this is politicized and frames a really difficult situation to trying to do our best in health and public health.
One of the things that was interesting is I too was threatened with my license. I did get censored as a physician who treated thousands of COVID patients by people on the internet, by people in government, telling me I couldn't express my professional opinion as a doctor and as a scientist. Ironically, it goes full circle, and it came once again from the politicization of this, where people thought they were experts based on I'm powerful, rather than I actually know what I'm talking about. And ironically, the things they censored me on, I turned out to be correct on. They wouldn't even allow a dialogue of medical professionals to actually debate the science on a national scene, rather than just one size fits all. We're going to let the government decide what's truth. And this is the problem I have with this. You mentioned during the opening statements, you said, or actually during the open question, you said that we didn't get information on vaccinated hospitalizations, which surprised me. I thought we did have some of that. I imagine that also carried over to ICU visits and probably deaths too, because we don't have that
Just to be clear, we don't have that at a national level. We at CDC collect data in cohorts so that we can follow that for vaccine effectiveness studies. But at a national level, we get hospitalization data, we get hospitalization for COVID data, but at a national level, we have never been able to get hospitalization, vaccination, and COVID.
Yeah, so that worries me because it seems to skew the data. And I see you nod your head, yes, I agree.
Well, I think it just speaks to the real challenges in our data flows and our ability to give data back to the American people when we don't have full line of sight of all the data that people are interested in.
Couldn't agree with you more, which I spent so much time, every time I admitted a patient, every time anybody was tested for, I filled out an egregious amount of EHR paperwork in order to answer every question before I did any treatment or any admission. And yet, we never collected data on one of the most important statistics of all, which is vaccinated patients and the effectiveness of hospitalizations versus ICUs versus deaths. It wasn't a fair conversation. It seems like that was avoided. Were you asking for that information, or was that just something that they didn't want to collect?
So, Dr. McCormick, let me just be clear. We were looking at that in our vaccine effectiveness cohorts, in our VISION and IV cohorts, so that we could report that out in vaccine effectiveness data. We were looking at that because we knew that that was critically important. But I do want to emphasize that we did not get data in aggregate. We are, again, just to be clear, we're not looking for PII here. We did not get data in aggregate on vaccination and hospitalizations. All that data that you're filling out in the EHR does not translate into public health data. And that is really why I've said our data highways are so clearly important if we are going to report on what is, on the outcomes that people are asking for. And our data authorities are so clearly important so we can present those data in aggregate.
And what's interesting is how much money we spend on that EMR or EHR every single year, billions, tens or maybe hundreds of billions of dollars, collecting information that you can't get a hold of.
And maybe if I could just say it again, hundreds of billions of dollars. We've gotten less than $1 billion for our data highways across the country, 3,000 health departments for our data modernization initiatives.
All right. Are you aware of the must-admit orders that some states, including New York, were using to send COVID-positive patients to nursing homes early on in this disease process?
You'd have to say more. I'm not sure.
So remember when we first had this pandemic started, and we didn't really know a whole lot. We just knew it was contagious upper respiratory infection as an infectious disease. By the way, this is not in the capacity of a CDC director. This is capacity of an infectious disease doctor. We're talking doctor science here. They had originally the must-admit orders that some states were using in order to push patients who were positive for COVID back to the nursing homes. Are you familiar with that?
I'm not familiar with that.
Okay. Would you say it was a good idea to send infected COVID patients back to the most vulnerable community of all, which is nursing homes?
I can't speak to that. I was not aware of that. What I can't, because what was the counterfactual? What was the alternative of them going there? What were the mitigation strategies there? Did they have singular rooms? So I think that there are a lot of parameters that would affect my answer to that question.
I think you might be a better politician than me right now. But I would say that if you were to be a scientist...
I am a scientist.
And to be a doctor who was talking about putting infected COVID. Now, I know how much time we spent and effort we spent separating our patients at the hospital, the COVID patients from the people who are not positive. And I would say, I'll just make the statement for you, it's a bad doggone idea to send infected COVID patients, one of the most deadly diseases, as you stated, back to the most vulnerable populations of all by direction of the state, by their legislative actions. And with that, I yield.
I now recognize Mr. Jordan from Ohio.
Thank you,
5
Mr.
minutes.
Chairman. Doctor, why did you and the Biden administration mislead the American people?
You'd have to say more. I wouldn't claim
March
that I did.
29, 2021, vaccinated people do not carry the virus. Vaccinated people don't get sick. We got that information from clinical trials, but also real-world data. It seems to me there are a number of statements you make in there that aren't accurate. Do vaccinated people carry the virus?
In March of 2021, the vast majority of data demonstrated that the vast majority of people were not getting infected if they were vaccinated.
That's not what you said. You didn't say the vast majority of people. You said vaccinated people do not carry the virus. Was that accurate?
It was generally accurate.
Generally accurate. Why not just be accurate? Why not just tell the American people the truth? Why not you say to the American people just what you said to me? We're big boys and girls. We pay your salary. The government is supposed to be of the people, by the people, for the people. Why not just tell us the truth?
I was speaking.
Was 6 weeks later when you said if you were to get infected during post-vaccination, you can't give it to anyone else. Was that accurate?
What was the date of that?
May 19, 2021.
At the time, we had the Wuhan strain and then the Alpha strain. That was the Alpha strain that was circulating. That was generally true, yeah.
Generally true again? Why not again? Why not tell the American people this is generally true?
I couldn't tell you the exact data on the vaccine effectiveness of symptomatic disease and severe disease at the time. What I can tell you is that we generally saw that if you were to get infected after you had been vaccinated, that you were not carrying the virus by transmitting it to somebody else. You could not transmit it to others.
But we know that's not accurate.
It was at the time. Now, what
Really?
happened? Yes, in
Really?
May of 2021. That was true for
Really?
the Alpha variant. What
Well,
happened?
let me ask you about all the general statements that were made to the American people, not general statements, the way you guys said it. You said, was it our tax dollars, were our tax dollars used in the lab in China?
That is something that you would have to speak to NIH about.
Our tax dollars were used. It sure looks like it was gain-of-function research. It sure looks like it actually came from the lab, and we've had several agencies, federal agencies, say that's in fact where the virus originated. The Biden administrators told us that the vaccinated couldn't get it. We know that's not accurate. The Biden administration told us the vaccinated couldn't transmit it. They told us masks worked, and they told us there was no such thing as natural immunity. That seems to me to be, 7 different statements that turned out not to be true that we got from this administration. Again, why not just tell the American people the truth?
So I would dispute some of what you just said. In October 2021, CDC released a scientific brief highlighting all of the science that was out there on infection-induced immunity. And I don't know the long list I don't remember all the long list, but there are numerous areas where we have provided science and the science review to provide data to the American people as soon as we had it.
I actually think what happened is you actually tried to be honest with the American people, and the Biden administration shot you down. You remember when you said this in February? This is before you made these statements, which I think are not being square with the American people. You said vaccination of teachers is not a prerequisite for safely reopening schools. Did you make that statement?
Something to that effect. I can't exactly say the quote, but yeah.
Vaccinations of teachers is not a prerequisite for safely reopening schools. I think you made that statement on February 3rd. Do you stand by that statement?
At the time, yeah. We had a week later or 10 days later, we had an operational guidance that demonstrated layered mitigation strategies and that you could safely reopen
Were you
schools.
speaking as Dr. Walensky, or were you speaking as Dr. Walensky, head of the CDC?
I have said that while I've been in front of Congress and the media in press conferences, during my tenure as CDC director, I've been speaking as the CDC director.
But that's not what the White House said, right? Jen Psaki said Dr. Walensky spoke to this in her personal capacity. Do you remember that statement?
I do.
Who's right?
You
Jen Psaki or you?
Well, I will tell you that I was speaking in my
Looks to
role
me,
as the CDC
looks
director.
to me like what happened is in February you said, I'm going to be honest with the American people. I'm going to give it to them straight. Vaccination of teachers is not a prerequisite for safely opening schools, and the Biden administration hung you out to dry. They said, nope, she ain't talking for us. She ain't talking as the head of the CDC. She's talking as Dr. Walensky. And then a month later, you said, well, you know what? I better not be totally honest with the American people. So I'm going to say vaccinated people do not carry the virus and they don't get sick. And everyone understands, like, wow, I know someone who's been vaccinated and they've gotten sick afterwards. I think what happened is you tried to be honest, and they said no, and then you said, well, I'm going to have to hedge a little bit. I'm going to have to give the American people misleading statements from the head of the CDC. You were speaking as head of the CDC in both situations, right?
I have said I've been speaking as the head of the CDC.
All the time? Yeah. Well, it'd have been nice if you'd have just been honest and straightforward with the American people every single time throughout this virus. With that, I yield back.
I have stood by my commitment to tell the American people what I know when I know it. Thank you.
I now recognize Mr. Garcia from California for 5 minutes.
Thank you very much, Mr. Chairman. Dr. Walensky, thank you for being here today. I greatly admire and just appreciate the work of the CDC and just the talented personnel and civil servants, and particularly in what was and has been the single largest health crisis that we have had here in the modern era, costing 1.3 million plus American lives, 1,300 lives within my own city of Long Beach, where I was the mayor during this entire time. And so I know the hard work that you and your team have gone through. And I also want to note that it's just been interesting to hear this hearing and seeing so many of our House Republican colleagues in the majority all of a sudden just have such interest in exactly what happened and medical expertise, considering that they are and have been completely whitewashing the Trump administration's role early on in the pandemic and their political interference, clear political interference in actually what happened, and trying to consistently insert themselves into the CDC response and the CDC communication to the American public. We want to remind us that President Trump repeatedly tried to undermine the CDC's work and advance his own reelection campaign. We've heard a lot about President Biden the current president's name being brought up, but it was President Trump, as we should remind ourselves, that actually led the initial response and time again tried to interfere with the CDC's work that at the time was very, very difficult and continues to be. I also want to note there's nothing that suggests that teachers somehow played some outsized role in CDC policymaking, and there's certainly nothing to suggest that they somehow got health experts to make dangerous concessions or changes. There is no evidence of that. It is a political talking point by the House majority. They love to continue and go on and on about it, but there's no evidence of that. We also know that House Republicans actually sat back and did nothing when President Trump and his allies interfered in their work to cover up his own incompetence. Now, Americans died because of the political action, in my opinion, of the former president, and some people here cheered on the president's former dereliction of duty and interference in these actions. I want to be clear and remind us of a few things. Last year's Select Subcommittee report found that the Trump administration conducted a systemic campaign to compromise the integrity of the CDC's pandemic response in advance of the 2020 election and to help former President Trump. On February 26, 2020, he and his allies mandated that all media requests about COVID be first approved by the White House. CDC officials have testified that because of this, there were extended periods of time that his administration completely refused to approve critical COVID briefings to the American people. That's shameful and should never have happened. And throughout that year, as tens of thousands of people were dying, his staff pressured health experts to soften language that might make the president look bad. His allies attacked CDC scientists for publicly sharing information that they believe contradicted the president's message. I want to give an example. In an email from May 8, 2020, that shows that Trump allies installed at the Department of Health and Human Services seeking to edit talking points on a CDC report and saying, and I quote, "Any way to help you showcase your work for this great president," end quote. That would, of course, be appreciated. A few weeks later, they even went as far to suggest the CDC edit a statement on COVID deaths to make it, quote, more positive. So the Trump administration pushed staff at the FDA to authorize ineffective treatments like hydroxychloroquine. We know some of the damage that caused as well. And the president even would tag health officials on Twitter and accuse them of deliberately slowing their work on vaccines until after his reelection. All shameful. Of course, not of no interest to the Republican majority here in this committee. Dr. Walensky, can you clarify for us clearly, did the American Federation of Teachers once and for all water down or direct CDC policy on school reopenings?
The American Federation of Teachers was one group out of 50 that we engaged with that were essential implementing partners if we wanted to get schools open. The whole goal was to get schools open. We talked to teachers, we talked to superintendents, we talked to school nurses, we talked to parents, we talked to the immunocompromised community to get our schools open.
Thank you, and I think that's what we have heard over and over again and from everyone involved, and I want to thank you for that again. Now, I think we can all agree, especially given what we learned from hearings in the last Congress, that it's critically important to have a CDC pandemic response guided by medical practices. In fact, when asked in an interview last Congress whether allowing CDC to convey accurate scientific information to the public would have resulted in fewer Americans dying, the agency's former principal deputy director responded, "Yes, I do," which should be alarming to anyone. And so I think it's of note that we have to remind ourselves that the Trump administration, time and time again, tried to interfere with the CDC's response and all the great work that you would all do. So I just, with that, Mr. Chairman, as I wrap up, it's insulting that House Republicans sit here today trying to score political points around our pandemic response, even as they cheer on the man who is willing to let Americans die to help his reelection. With that, I yield back.